What is more interesting to you? Now, immediately I gave some information and got some feedback, negative feedback. Why do you doctors go to drugs? I mentioned a drug called the beta blocker in there, and I mentioned an over-the-counter prescription that he could use. Why don't you use a natural cure? He was a triathlete, and after he wrote the note, I decided I'd go to a website. I bet he was selling something, and he was. He was selling himself as a coach. But anytime you get negative information, that's great. Somebody's listening. If they give you negative feedback on what you've said, you've hit a nerve. It may not be a good nerve or a bad nerve, but follow that up. It's important. Number 2, know your attention span. What's your span when you're going to a website? How long does it take before you decide you're going to stay on? You're out, right? It's about 3 seconds, don't you think? Facebook, if it's your friend, a little bit longer, probably like 4 to 5 seconds. Newspapers, you're going to start at the beginning of the article. You're not going to go to the middle of the article. You start at the left and you go down to the right in the newspaper. Not so with TV. With TV, you may be walking into the room and all of a sudden you hear the word sex or something else that interests you, and then you listen to the rest of the TV thing. So if I do a minute and a half on TV, which is what I do on some of the things I do, or 3.5 minutes, I have to assume that people are listening to part of it, but not all of it. It's very important when you do anything in terms of broadcast. They're not listening to the beginning of the broadcast. Same for the radio. Books are a little bit longer, but the attention span is a major part of the issue. And it's changed through the ages. If we look at the doc on the left, front of Life magazine, like Time magazine, Life magazine was a wonderful magazine when I was a kid. But it's very different. That's not the time we have, and this is not the time we have. It's not horse and buggy, where attention span was slower, among other things, because life was slower because there wasn't as much information coming in, and frankly, it was probably boring. Probably boring much there, so they would listen to you. When Lincoln gave his speech, which was 236 words, it was a 2.5 minute speech, and we all remember it because it was remarkable. He founded the soundbite. Every sentence was a standalone sentence. Every sentence was wonderful. If you read George F. Will's book called The Gettysburg Address, he explains it. The people didn't come to hear Lincoln. They came to hear a guy named Edward Everett, which was president of Harvard, who had a booming voice, and he spoke for 3 hours all about the gladiators and this and that. Nobody remembers him. Nobody remembers his name or his speech because it was the soundbite that counted. It was what it was. And it's speeding up. Our information is definitely speeding up. We have Marcus Welby. Does anyone remember the guy on the left? No one? Ben Casey. Come on, there are people my age in here too. And of course Scrubs, and then we have Dr. Oz. So number 3 is you want to know your audience. So what is the audience that you're speaking to? And then that has to do with how you're crafting your words. The audience may be mixed when it comes to smoking. It's young, it's medium, and it's old. But knowing your audience is important both in the words that you're going to use and the context that you're going to be using your words. Very important in terms of that. Because their reality is not your reality. Their reality is different. I don't really know the reality of the guy on the left who's in the truck. I know it to some extent. But I have a ton of truck drivers who listen to me and write me. They are actually, outside of Wisconsin, they're the number 1 source of our radio calls, are truck drivers. Now, in my brain, I think, truck drivers, why would they listen to public radio? But the answer is, they listen to public radio. That's the answer. So knowing the audience and what their reality is very important. Truck drivers going, you're talking about the Mediterranean diet. Try to go through Nebraska on Interstate 80 and find the Mediterranean diet at your local truck stop. Duh. You have to bring it in yourself. Okay, what do you want to accomplish? I think 3 are great. I think if you can accomplish 3 things in a minute and a half, or 3 things in a piece of information you're writing, you're on top. It may be less than 3. It can't be more than 3. I can't hold more than 3 things in my mind. You give me a list of 7 or 8 things, I'm going to remember 3 of them. I'm not going to remember 7 or 8. So I think the rule of 3s is very important when it comes to crafting whatever the message is. So I think keep that in mind. If you try to craft too much, you probably will not succeed. And you should pay attention to Mark Twain's dictum. I'm sorry I wrote a long letter. I didn't have time to write a short one. That's a famous quote from Mark Twain, and he's absolutely right. You can always cut it down, and you can always cut down the information that you're using. I think within that discussion, you have to show respect of what they're using, and that's in terms of verbiage and words. You have to discuss what the solution is, and you have to hit it home and how you get there. And those are three different things that I think of when I'm crafting any of my messages. Now, when I'm on the radio and I'm answering things back and forth, I might have a minute and a half, I might have 3 minutes, but I have control over the time on the radio, and I can interact with the patient. On TV, I have no control over the time. I know it's a minute and a quarter, and I have to finish it, so I have to be a little bit more crafty on TV. If you're writing a written piece of information, and let's say it's 500 words, you can do it through the use of fonts and squares. And a perfect example in our group, I'm with the large group, the Dean Clinic, in Dane County. And I was looking at the information they were sending when there were upgrades in Epic, our electronic medical record. And the information was awful. It was terrible because they just didn't have it done in the way of how is it going to affect me. And we looked at the rules of three, and we looked at this, and made just a new way of crafting the information so people wouldn't immediately hit the delete button, which is what we all do with information that we don't think will control it. So, number 5, publicity, good or bad, as long as they spell my name right. So once again, if you get information back and people are giving you feedback if it's good or bad, try to then figure out what it is that is good or bad and change your message. And that is Tommy Bartlett. Number 6, control your vocabulary. So, the speaker that I went to yesterday really drove this home. It's amazing how the words that we tend to use that other people don't necessarily think about, that we think about. Now, it's clear that myocardial infarction and heart attack is right there. But there are other things. Statins, a cholesterol pill, osteoporosis, soft bones. Urinate. When do you use the word pee? Well, you're not going to use the word pee in a senior citizen. You're not going to say that. You may say urinate, and they're not going to necessarily tell you that they don't know what urinate means. I think of urinate as something I say all the time, but the reality is they may not know precisely what it is. Think back to my neighbor next door. 1 tablet twice a day with food. Didn't think enough to call up the doc and say, they're not eating, can I give them the medicine? So you've got to think about that in terms of your vocabulary. Bowel movement, poop. I was talking about a bowel movement to a mother and a kid a week ago because they came in with abdominal pain, and they both looked at me and said, bowel movement, what do you mean? That's what they said. What do you mean by bowel movement? I said, BM. I said, stool. I realize now I'm grabbing for words. And then I said, poop. Their eyes lit up. Poop. Poop and pee. And I realized I didn't know what I'm talking about, poop and pee. And we always tend to go to the words that are most comfortable to us, that we think are technologically correct, and we think may show respect, when in fact the people that we're engineering and talking to just want to know what the hell we're talking about. That's all they're looking for. So the vocabulary, is it a senior citizen? Is it somebody mid-age? Is it a young adult? Is it a teenager? Can you pronounce it quite properly? If you're in a room with somebody and you're talking with them and they're older and they have a hearing aid, have you ever said, can you hear me? Very important. A lot of times they can't hear you, and they'll say, can you talk louder? But they're embarrassed to say, can you talk louder? When you're talking to them, if you're talking softly, and they may be sitting 2 chairs away from you, when in fact they really should be sitting right next to you. And if you don't ask, they may not tell. Don't ask, don't tell. We got rid of that. Remember? We're getting rid of it here too. So it's very important. So I always use the Australian Nun Test when I show respect. The Australian Nun Test is this. They speak English, but they're from Australia, so they interpret it in a completely different way. And if you want to look at something in a respectable way, and you're talking to somebody who's older and you're not sure how they're going to interpret it, and you just assume that their English is not your English, and how are you going to actually speak to them? And I have found that very, very useful in terms of looking at respectable discussions with older adults, because older adults are much more of the Emily Post era. When I walk into a room in my office, if there's somebody 65 or older, and I walk in, they will often get up a little bit from the chair to greet me. They'll get up from the chair. They're coming in because they're sick, but they're getting up to greet me. Somebody who's 25 never gets up. They never get up from the chair. In fact, they may not even stop texting, when I'm going to the office. And they'll say, just give me a minute, I have to finish this. Which I don't do, by the way. As you say, I'll come right back, and they'll say, okay, and then they'll shut off their phone. But they don't get up. Australian Nun Test is very good when you're thinking about the words that you're using.